Hello, everyone, and welcome to the Medical Fitness Podcast. Our podcast is brought to you by the Medicine Rehab and Fitness Institute and JY Kinesiology LLC, both of which are dedicated to medical fitness education and building the bridge between medicine, rehab, and fitness. You can learn more at mrfinstitute.org. The purpose of our podcast is to provide you with principle and evidence-based content on all things related to exercise science, strength and conditioning, medical fitness, and building the bridge between medicine, rehab, and fitness. In this episode, I interview my co-host, Dr. Thomas Hammett. Thomas is a physical therapist unlike any I've ever met, and I'm very fortunate to have him as a partner in my professional journey. During our talk, we discussed what led to his clear understanding that physical therapy is not just about fixing people's pain, it's about healthcare, the whole person, and understanding that the patient's time and treatment is the perfect opportunity to set them up on a long-term plan of care, which includes referrals to exercise specialists. Thomas gives insight into the unique model where he works at Pinnacle Medical Wellness in Seattle, Washington, which fosters this collaborative environment, a model which should become the prototype in physical therapy. He talks about why medical fitness is such an important part of the medical model and what physical therapists can and should do to better position the PT field for success. If you want to be among the best, you have to learn from the best. So please take the time to listen to this extremely important message, one that we're going to build on over time. All right. Hey, everyone. Welcome to the Medical Fitness Podcast. And for those of you who viewed our recent podcast where Dr. Thomas Hammett here, who is my co-host, interviewed me, I now get the opportunity today to flip-flop things, which I've really been looking forward to, and put the spotlight on him and interview Dr. Thomas Hammett. So he is a industry leader and subject matter expert on a bunch of things, but we're going to get into that today. And before we do, first, let me just welcome you, Thomas, to our podcast. And thank you for giving me the opportunity to put the spotlight on you and interview you today.
Yeah, man, this is fun. Thanks for putting me in the spotlight. This is it's nice. It's lower pressure than interviewing you. So I just get to talk about myself. That's easy.
Exactly. Yeah, so I really want the viewers and listeners to get to know you better and understand why it's important, really, for both of us, but from my perspective, for me, to have you as a friend, as a colleague, as a co-host of this podcast. And so I want to really start to dive into who you are and what you're about, and then we'll build on that in future podcasts. So, like would do with any guest, I think the best way to start is for you to just give us your story, a quick professional background, and it'd actually be interesting to share why you think that I asked you to be a co-host of this podcast.
Yeah, sure. Okay. So where to start with that one? I think what I tell people really right now is that I'm a physical therapist by training, but I've got a lot of hats that I wear. My current position is as the director of clinical services for a company called Pinnacle Medical Wellness. And what I'll do later is share a little bit about like what the practice model is and even my experience coming out as a new grad, practicing as a PT in Pinnacle. So maybe go back like 10 years or so. I was finishing up a kinesiology degree at Washington State University and knew that I wanted to go to PT school. Ended up at Duke University for PT and got to be a part of this really amazing program. One that was really focused on medical communication and team-based learning, which I think was a big part of the underpinning of like my understanding of the importance of collaboration in practice. But also how important the words that we use are when engaging with, with my patients as a PT, right? So in addition, as part of that program, I got to participate in a global health program and did a clinical rotation across the Atlantic over in Norway and learned a lot about different medical systems and internationally, what the infrastructure is for medical care in different countries and in a country like Norway, which is quite different than ours. And it gave me some really good perspective on not only how the medical system works, but how people in different cultures view their responsibility for their health too, and how people behave in a system where they have to be a little bit more accountable to their level of health, just based on the way that infrastructure is set up. So coming back to the United States, totally different perspective. Right after coming back from Norway, I graduated, got my entry-level job, interviewed at a company called Pinnacle that, if I'm being honest, I showed up at this clinic in my hometown for a practice interview. I was doing a favor for a friend who really wanted me to go interview with one of their friends. So I sat down across from Josh and Stacy Lyons. And they just blew me away with some of the stuff they were saying around kind of a bigger picture of what PT can do. I was interviewing at outpatient orthopedic clinics, which means that, a lot of the focus, particularly for people who are coming in and getting started as a new grad, they say a lot of things like, I want to get, I want to get experience and build my manual therapy practice, right? Like I want to help people with segmental joint issues or specific pain from a musculoskeletal perspective. And of course, that was what I viewed my kind of like my value as a medical provider, but I also knew there was a bigger picture, right? Like I had seen and gotten perspective of what PTs can do and in different settings and how movement helps people beyond just the short term, like pain fix kind of stuff, right? And the only place that I ever interviewed that had a message that sounded like that was Pinnacle. And when I walked in the clinic, there was a dietitian on staff. There was an exercise facility that didn't look like an exercise facility that I'd seen before. It was kind of this thing that I thought I understood, but didn't really quite understand yet. And a fitness professional that was in-house. And, that practice interview turned into a career for me. I'm still working at Pinnacle. I have climbed up the ladder a few rungs to the position I'm in today. I get to speak with all kinds of different groups on integrating fitness and medicine beyond physical therapy. So cardiac and pulmonary rehab specifically over the last year has been a big focus for us. We work closely with a company called Technogym that uses some really great technology in fitness to help us learn a lot more about how our clients are progressing and improving their fitness. And, I'm big into the data kind of stuff, like certainly from a physical therapy standpoint, we could talk for a long time about how PTs and medical providers in general are really hamstrung with the way that medical data is managed and shown to patients and clients. And we just have to be better at giving people a better way to view their progress and their health than what currently exists. So that's a big passion of mine. But, on the other side of it too is, advocating for PT and change in our profession, thinking of our lens being different than fixing short-term pain when thinking about it from the orthopedic standpoint. And when I say fixing short-term pain, what I really mean is the ability to interact with people over a short period of time, like 6 to 12 weeks, to try to reduce pain as being really our only value in the medical system. If that's the way that people see us, then we're not going to persist for a whole lot longer. We have to adapt and change. And, that's something I'm working really hard to just visualize a model where that works, and presenting on it all over the place in physical therapy, at the private practice section, at the combined sections meeting, doing that with a fitness professional every once in a while that I know. I'm sitting on the other side of the screen right now. So I think that's a good background to start. I guess the other thing that I would add is in 2019, I got a advanced certification in lifestyle medicine through the American College of Lifestyle Medicine. That's actually one of the ways that I got to know Jeff too. And that was a really good introduction to me, that group was doing some things really well. In particular, bringing together medical professionals of different backgrounds, different professions. So being a really good interdisciplinary group that worked, where a lot of medical organizations like the ACSM are primarily fitness professionals, though I think they would say that they're fitness professionals plus XYZ, including physical therapy. The American Medical Association is primarily physicians, but the ACLM is everybody. I mean, it could be anybody who's interested in learning about lifestyle. And I thought that was a really, a great thing, great organization to be a part of. And yeah, so I think that's maybe where I'll stop and let you start to ask some questions that expand on whatever you want to know about me.
So that's such a cool perspective for the whole Norway thing, which you said it was Norway, right?
Mhm.
Yeah, and that's actually something I didn't know about you. And I didn't know that you did that clinical rotation. And so yeah, what an amazing opportunity to give you the perspective that you now probably will carry with you for the rest of your career, right? And so before I actually ask my next specific question, you and I touched on this when you interviewed me the other week, but I want to mention it again, and you actually just alluded to it, that Thomas and I co-presented at the American Physical Therapy Association's combined section meeting annual conference in San Antonio a little over a year ago, and it was a 7-hour pre-conference presentation. So that's there was a lot of build up to our, you and I building up our presentation and going over it and over it and over it and tweaking it and all the conversations that went along with it. And I had already kind of, been getting to know you fairly well as both a friend and as a professional leading up to that. But that experience really allowed me to start diving deep into what, your mindset is professionally. And, you just touched on some of this stuff, but, um, it gave me the opportunity to see that, yes, I have worked alongside physical therapists for going on 20 years, but Thomas is just so different. And he really sees things, like he just mentioned, from the majority of the physical therapy field and therefore the physical therapists that I worked alongside, see things from this fixed broken part perspective. Whereas Thomas understands the importance of that, but that it fits within a bigger picture, which is what led up to all that stuff, and what leads up to it is um, the fact that so many people are deconditioned and have disease, comorbidities, and the uh, underlying chronic inflammation that goes on, how that affects things at the cellular level, how that then can lead to pain and dysfunction and things like that. So with that said, now I'm going to lead into the question is that as I got to know you from that perspective, and then also Pinnacle and the model that you have there. And I had never, I've worked in several hospital settings, I've worked at several private practice physical settings. I had never heard of anything like what you do at Pinnacle. So that would be my next question is if you can tell me a little bit about Pinnacle's model of care, what it's like practicing, both as when you first came out as a new grad, but also now. And then
Mhm.
that I'm sure that will lead into some more questions.
Yeah, for sure. I'd love to share about that. So I guess the first place to start, maybe I'll start with like what my experience was when I came out as a new grad, because that's kind of picking up where I left off.
Yeah.
I so I, the clinics that I practiced at, so I practiced at a small outpatient clinic, and I guess small is relative, right? So we did have a fitness side, about 2,500 square foot facility, that, it had everything that I could possibly want. Right. So I started practicing here. And one of the first things I had to learn how to do was do this process that we were calling health risk assessments. And, this isn't a new concept in medicine necessarily. People have been talking about integrating a health risk assessment into practice in different areas of medicine. Some do. A lot more in like a concierge model of care than actually integrated into your, and maybe like, you get a physical with your physician, but does your physician ever sit down and talk to you about it? So what we did at the beginning of our physical therapy encounter was actually had an exercise professional greet the patient. So the fitness professional will walk up front, introduce themselves, say, hey, I'm going to get you started today at the initial evaluation. Come on back. You'll be working with Thomas Hammett today. He'll be your physical therapist. To start with, I want to get some basic health information from you, and would go through really just like a basic health vital screen, right? Like taking a good comprehensive vitals, but then we made it transparent to the patients as well. And just as part of the PT evaluation, what I had to learn was, okay, so I've got this extra information about a patient's health, like not their shoulder necessarily, but the bigger picture of health. What do I do with that? Like, is that something I can actually use with developing my plan as an orthopedic PT? And, I really had to come to grips with that because, I think a lot of the time what informs a physical therapist in the outpatient setting and what they're going to do is, let's look at the movement limitations. Let's look at weakness. Let's look at pain. Certainly let's screen for red flags or their neurological kind of things going on. But then to think about factoring in blood pressure or cholesterol or A1C as part of like what I'm thinking about with regards to how I can help this person and what kind of plan I'm going to put together, man, that was a big stretch from coming out as a new grad and the orthopedic experiences I had. So, I had to learn how to think about that in a way where I could talk to people, like talk to someone who maybe had never had a conversation about their blood pressure before and make it relevant to the reason they were coming in. Because there were a lot of times I screwed this up, and and I get a face that was like, why are you wasting my time with this? But then two, it's like, well, tell me what this has to do with my shoulder. You're supposed to fix my shoulder. And, that goes into a whole other side of this, like, my role as a PT is not to fix you necessarily. There are a lot of things I can do to help and set up a plan for you to be successful and care for yourself. But man, most of the PT is what people do for themselves, right? So I had to learn how to have that vitals conversation, how to be really comfortable around talking about those things. I'd never really had a conversation with someone about their A1C before. Diabetes is a really sensitive subject. Something I've learned in practice is that there's a lot of people that have an A1C over 6.5%, which is the threshold to be considered with type 2 diabetes, and that have not been told by a doctor that they have type 2 diabetes. So it can be really sensitive having that conversation. Anyways, I guess the point I'm trying to make is that I had to get in there and figure out what the heck I was doing and how.
Different world. It's a
Yeah,
whole different world. You literally had entered a whole new world.
But why that's so important, and to me, what makes it so relevant, I tell this story about my optometrist. So I just got LASIK, so I'm hopefully not going to have to see Dr. Neal for quite a long time, but I've had glasses my whole life, or contacts. And, every year I have to go to the eye doctor and get my new contacts. And when I walk into the eye doctor's office, there's this big poster that shows two different eyes. It's like a diagram of an eyeball. And on one side is the normal eye, and it has this perfect optic nerve, and, the blood vessels look great, so on and so forth, right? And on the other side, there's this eye that has diabetic retinopathy, and it shows all these like crazy bursted blood vessels at the back of the eye. The optic nerve isn't looking so good. And, the thing that eye doctors have figured out how to communicate and diagnose and make their practice relevant to people who are dealing with chronic conditions, and visualize that to people in a way that's meaningful. And then we as PTs who are dealing with the entire rest of the body that's dealing with a similar level of breakdown haven't been able to communicate that same thing with regards to the conditions that we see, is just so frustrating to me. And, some of it is that the musculoskeletal conditions are complicated. That pain isn't always just a matter of injury and pain that happens right away. It's like, I know it's more complicated than that, but at the same time, we overcomplicate it as professionals. And so, what I had to do is make it that simple. I had to make the conversation, listen, there's some underlying stuff that that we can and that I would recommend that we deal with as part of this plan of care, um, that's something that I want to include in your plan. Is that okay with you? And you know, that's the benefit of working in the facility that I was in, is that, you know, from that point, after making it relevant to the reason that people are showing up, yeah, they're way more interested in meeting with a registered dietitian about their nutrition, or way more interested in, you know, I started exercise with this physical therapist, and you know, I feel like I'm just scratching the surface on what I can do. I've started to build a habit, but maybe exercise long term is something I can start to do more often. And, you know, I met that fitness professional at the first visit. They've come around a few times in my plan of care. And now, like, I can really see myself working with that person. Maybe I'll give it a try. Right. Whereas, like, you know, and there's a lot of different PT models that have tried to integrate fitness professionals, and there's struggle, right? Because it's kind of like this salesy thing that happens at the end of PT that feels like,
Yes,
it feels yucky, right? It's like, hey,
exactly.
by the way, you know, I know that your issue's fixed now, but you know, like, if you want to go see Jeff, uh, it would be a really good thing for your overall health. And it feels like there's so many reasons it's wrong, right? It's like it's too late. Like, they feel like they've dealt with the thing that they came to see me for. Um, you know, yeah, there's a lot of reasons why it doesn't work like that. But anyway, so that's, I guess, maybe the best way to share what the idea is behind the practice model that we have, and why I feel like it's so important that we have those extra services within our clinics, and that we learn how to work and collaborate with those professionals and understand what they do well. It's why the fitness side of things is so important to me, because we get people started with exercise, and you know, it's easy to get an athlete to keep exercising, but the rest of the public needs it so much. So if we can make that connection meaningful, something that people understand, um, you know, that's the goal. That it's really the goal with what we're trying to do.
So we have this picture that's being painted where it isn't just about fixing a broken part, which is what how much of the PT field operates. That the PT field needs to or PTs need to understand that they are a blip in the whole process. You know, part of your presentation at the APTA CSM conference was you had a bunch of slides, if I remember correctly, that talked about how even the American Physical Therapy Association advocates for this. They have a Health Promotion and Wellness Council. They have position statements. They talk about how PTs are, can play a major role in health promotion and wellness and this bigger picture. And so, what you're talking about is that and correct me anywhere I'm wrong, but you go to your DPT program at Duke, and you're not really learning. I mean, you're probably touching on some of this stuff, but not in the sense that you practice now as a professional and at Pinnacle. So you're learning some of this stuff, but now all of a sudden you're opened up to this whole new world that makes total sense. And but it also includes a lot of very different things and forces you to practice in a different way because it forces you to have the tough conversations that we've talked about before that you, Sheila, and I, when we presented at the American College of Lifestyle Medicine conference back in November, talked about, and that it is about getting out of your comfort zone as a clinician a little bit, having these tough conversations. And it also, you talked about how the way a lot of these um, practices set up their model, if they do happen to have a fitness trainer or fitness trainers within the model, is it's very awkward, it's clunky, it's at the very end. Whereas your ingenious, it is ingenious. I have never heard anything like this before in my life, and it's ingenious. Where you get you have them, you introduce them to the fitness professional or exercise physiologist right from the start. That way, the patient is probably thinking, "What? I thought I was coming in here for physical therapy, and what's this all about?" So it kind of lets them know right from the jump that this place is different. And then, like you said, there's some interactions going on, and you're talking right from the beginning about a longer term plan of care. And so that is my way of explaining kind of what you just said and why you're so different to me. And why, and yes, you hit on a major frustration of mine because clinicians in general, I don't want to just pick on physical therapists. Clinicians in general feel like it's a sell. I have to sell fitness to my patients, and it's not a sell. If you do it in the way that your model is set up and get things started early, and if you're an exerciser yourself, because that's another thing is you really walk the talk. You strength train, you aerobic exercise, you run marathons, you hike, you ski, you cross train, you do all this stuff. So it's easier for you to advocate for it too from all different perspectives. And that's what makes you different and this model so different. So with all that and me, hogging some time here, you talked about medical fitness and the importance of, because that's what I'm all about, the medical fitness side. But we talk about all the time that moving the patient through the medicine rehab fitness pathway into the medical fitness. So my next question to you is, why do you think the physical therapy perspective and your perspective is so important in this conversation about medical fitness? By the way, most people looking for the services of a fitness professional are really just looking for information on how to get started on the right path, not to pay for training sessions every week for months or years on end. For the 60 to 70% of people with chronic disease and or joint pain, they're also looking for someone who can help them develop a clinically safe, individualized exercise program that takes their conditions into consideration. If you're interested in getting yourself, or for clinicians, your patients, started on a safe, cost-friendly medical fitness program, you can find more information about the virtual services we offer at mrfinstitute.org/services. We staff only degreed kinesiologists and exercise physiologists and will work with your healthcare providers in the design of your exercise program. For the clinicians listening in, you can add this virtual service as a reduced cost option for your patients. Check out our website and send us an email, and we'll give you the details about this unique and much needed service.
Yeah. So, hmm. Yeah, this is a big question. I really appreciate you framing it like that. And I think there's a lot of things I want to say here, because of the way it was framed, which is great. I think why PTs are so important in this. So many people that are the people that we would hope end up in a fitness program are the ones that aren't the ones ending up in a fitness program, right? Like the people that we really want, when you look at the health situation in the United States, um, and the number of people that are not physically active, that don't participate in exercise programs on a regular basis, we have a lot of room to improve. And, it's a major opportunity, particularly when you think about it on the medical side, where people are having interventions related to their health. And if you view exercise as a health intervention, that's really where someone in the medical system needs to intervene. And, certainly it needs to start with primary care. And what I'll say is that any case that was well set up by a primary care physician was much easier for me to help facilitate movement into fitness from there, right? So it always helps when primary care people, like what I would consider to be across the spectrum of care from me, specialty care like endocrinology, the people that are seeing and making, the primary recommendations for type 2 diabetes or kidney disease, cardiologists making recommendations for exercise. It's so important to start in those places.
Yes.
But then inevitably they're going to end up with me, because physical therapy is right now typically the de facto exercise or pain referral that exists within medicine. And I'm not saying that that's necessarily the right thing or the way that it should be in the future. I think there's a way that that a PT or exercise referral, ends up maybe with one session at a physical therapist, or just going straight to the fitness professional if that's appropriate, right? If there's, no physical issues that are preventing them from starting an exercise program. No, I think there's tons of reason why PT could be the person to do the initial screen if they're doing a good job of making that movement across the chain. But I guess the reason that PTs are so important in this situation is that we're receiving the referrals right now for the population that we would really hope to be the people that, and I think the people who would say, I really want to improve my health and I just don't know how, or I want to improve my health. I've tried these things before and it hasn't worked, or, and but this again, is another one of the things that I learned in having conversations with patients about health. So rarely do you talk to someone who hasn't tried, right? Like it's almost never. Never do you sit across from someone who's in a place where they're not exercising or they feel like their nutrition can improve, and they say, "Yeah, I don't know. I've never really tried anything." Like that almost never happens. People have tried and it's hard to make that change sustainable. So often we resort to things that are unsustainable, a extreme crash diet, a exercise program, and not to not to poo-poo on Squattober, but like a month themed around
Yeah,
one type of exercise that
yes.
ends after that month is over. And that's a great community thing for people that are already exercising. But if you think that's going to be your gateway into a long-term exercise plan, yeah, that kind of thing is not sustainable. So what do you do? And I think we as PTs are just like, we're the people that can understand and reduce the barriers to movement and get people started with exercise. um, we've got to be better at doing that side of things, though. We really do have to be better at using that lens that I've been talking about, that you've mentioned a couple times, which is that it's not just my job to fix your pain. There's a bigger picture here. And I think one last thing that I'd say to this too is that at one point you explained something to me that I thought was really profound, Jeff, that I knew this obviously, but to hear it so simply put was really important. And an injury is really just tissue failure under load, right? And there's two components to that: the tissue failure and the load. And the more your tissue is predisposed to fail, the less fit that it is, um, the more deconditioned you are, the more likely it is to fail under loads that are smaller or things that shouldn't cause injury. And I am doing a disservice to my patients um, if I view the situation as I just need to fix that structure so that it's not injured anymore, because I'm completely ignoring the history of what potentially got us to where we are, right? And I think there's other people in medicine that know that. Primary care knows that. They don't have the time to intervene. We've got so much time to intervene with our patients. Typically, if I complete a full plan of care with someone, it's going to be potentially up to 10 hours of time face to face with the patient that myself and an assistant could spend. And there's so many reasons that we could go into, I guess, beyond this, but I think those are the big ones to me about why PT is an important member of this team. And yeah.
Yeah, and that's exactly it. We're a team. And unfortunately, we're not seeing ourselves as a team as a whole. There's obviously spots here and there that are, but as a whole, we tend to be um, at odds with each other when really we should see each other as a team. And you know that, and you actually had it as part of your presentation at the APTA conference that um, the Physical Activity Alliance and that one article, I can't remember the title of the article that you took that chart through. And in traditional medicine, it tends to be like a totem pole with like
Mm.
physicians at the top, right, and then allied health professionals, and then fitness professionals, and down towards the bottom. Whereas the Physical Activity Alliance is and their movement to try to increase physical activity is saying no, we should see each other as a continuum. So I just want the viewers to understand that within the context of all this is we are a continuum, and it just should make total sense to move patients from rehab to post rehab and beyond. And it all starts with changing the mindset. When I had Jessica Matthews on last week, that's one of the things we talked about as part of behavior change. That isn't it ironic that we talk about needing to change the behavior of the large subset of the public that is not exercising, or not that we need to change it, but we need to help facilitate change for that. But we need to change the behavior of clinicians and fitness professionals as well, every bit as much. So I just want the listeners to understand that that yeah, we're a continuum, and that continuum should just and physical therapy, as Thomas mentioned, is generally speaking, like you said, about 8 to 12 weeks, maybe 8 to 12 visits, or something like that. But the point is that it's a pit stop, and it's a pit stop that if physical therapists would maximize what's going on in there and be willing to change their mindset and have those conversations right from the beginning and talk about that long-term plan of care, it should then naturally and actually be easier to facilitate more of the subset of your patient population to be moved into the fitness and wellness domain, which leads to one last thing. Thomas is so I chair the National Strength and Conditioning Association's special populations. Um, it's a SIG, it's a special interest group, and Thomas is on our executive council. And one of the tenets, the foundation of our SIG is something that Thomas mentioned in what he just said, and that is we need, tissue gets damaged a lot of time, or most of the time, because it wasn't, or maybe even all the time, because it wasn't able to tolerate the load that was placed upon it. And the weaker you are, the more susceptible it is. And if physical therapy's job is only to get people up to where they were when they entered, or as close to it as possible, then it's just failing. And we need to progress people in strength. So we need to move people through that continuum, and then not be afraid of a strength and conditioning program that's set up properly and graded properly. But yes, physical therapy is a perfect start point. It's perfect. But it's just a hard, the home exercise programs and stuff like that are just a horrible endpoint. So I know I went off on a little soapbox there, but you and I will be talking about this in future podcasts in a little bit more detail. And I at least wanted to mention a couple things. So let me lead to my next question. Um, from your perspective, what do you think is the best strategy for getting exercise in general, or any aspect of it, more integrated into medicine?
Yeah, so man, there's so many levels to this, right? Like the level that I interact in is so I'm no longer practicing as a physical therapist. I talk like I am because I remember it like it's yesterday, right? But and because I'm in the clinics working with clinicians every day. Um, but the level that I see things at is a little bit so Pinnacle right now, my job as the director of clinical services, I um, help to manage and direct the therapy care for physical therapists at really 7 clinics right now across the United States, and that's growing amongst other things. But the lens that I see things at is like with patterns, right? Patterns of groups that are trying to make this thing happen in their communities that all look a little bit different but have the same issues. And I think, to me, there's a couple different ways, and right now there's this big push from both the the American College of Sports Medicine and the National Strength and Conditioning Association starting to get on board, spearheaded by you, Jeff, amongst others, to make this move to have exercise professionals be qualified healthcare professionals, which really means like if we're getting down to the nuts and bolts of it, it's to make fitness professionals be a more legitimized profession within the medical continuum. So, right now, fitness professionals probably are viewed as being outside of medicine or have very specific niches within medicine. For example, cardiac rehab, or athletic training. There's a lot of athletic trainers that work within like orthopedic surgery offices, or even in physical therapy offices in different states. New York State is one that really heavily uses athletic trainers. So I think my best answer for how to like make this integration happen, the idea of legitimizing fitness professionals and making a standardization for what fitness professionals need to know to be responsible in the healthcare space, it's really important. That part to me of just like let's get um, some kind of standardized curriculum or expertise or certificate or whatever it's going to be, like let's get that out there, because I think the fundamental thing that's missing that you and I always talk about is trust, right? Like, I trust Jeff Young, so I will refer to Jeff Young. And when I say refer, what I mean is sell. And like I know that sell word is a sketchy word in medicine. We don't want to feel like we're being salesy, but doctors refer or prescribe medication that costs a lot of money, and do it without thinking a whole lot too much about what the cost is going to be to their clients. We get into recommending a fitness professional that we know is going to cost money, which we know that exercise has health benefits that are going to appropriately serve the patients that we're working with, and yet we feel uncomfortable because it's going to cost money. So, to me, like that level of trust that you can gain through a recognition, through like some kind of standardized certification, is really important. I think that is like the base level thing that can happen. To me right now, if I was going to do one thing to make the situation change, to embed fitness professionals into medicine, what it would really be is that I I would make you teach a class at every medical school. And maybe I'd hop in there for a guest lecture, but just promote myself here for a second. But the understanding of exercise as a medical intervention is so is just so missing in medicine right now, from medical school curriculum. And the American College of Lifestyle Medicine is starting to do a lot on the nutrition side of things and integrating nutrition education better into medical school. It's just something that needs to be changed across every single health professional graduate education system. Every program across the United States needs to provide better education on exercise and working with fitness professionals, knowing what it looks like to work with someone who can help their patients in becoming stronger and healthier through exercise. And I think that'd be the biggest change that I would make right now. I think there's so many answers to that question, but that needs to be my answer.
Yes, and so this is obviously we can build off this and will build off this over the course of hopefully many years, and get deep dives into each of these different potential topics. So we're going to wrap this one up here in a second, but before we do, I just want to say that hopefully those of you who are viewing this on YouTube or listening to it on um, Apple or Spotify or wherever, hopefully you can see now that Thomas doesn't speak like other physical therapists, at least none that I've ever met. And the primary difference, if I were to sum it up, is that he sees the big picture. He sees the big picture, and his lens isn't just this, what can I do in a clinical setting to try to help the person's knee pain or hip pain or low back pain or shoulder pain or whatever. He sees that as a really small part of a very big picture. And that the big picture, unfortunately, includes a lot of problems systemically, and we would all just operate a lot better from a medical standpoint, rehab standpoint, if we just understood what he just finished saying, and that is that exercise really is medicine, and we need to incorporate that as part of the medical and rehab fields, industries, um, and as just a more natural part of the discussions going on and all that stuff. So, in any case, Thomas, what do you hope? Because you asked me this when you were interviewing me the other
Mm.
week, and what you would hope that people will learn from this podcast. Now, I want to flip the question on you. what do you hope that people will learn from our podcast over time?
Yeah, I think there's a lot of people, and I would imagine that the listener of whoever arrives at at our podcast is probably someone who is interested in this subject already. But maybe maybe I don't know. We reach somebody new who is just starting to think about this, or uh, is with a friend in the car and they're listening together and they haven't heard about like medical fitness, but they're a fitness professional, or maybe they're a physical therapist or a physician who I don't know, just like I said, happens to be an audience to us at a given time. What I'd hope that they could take away uh, is a better understanding of some of the nuance that exists in Jeff, we talk a lot about barriers. um, I think it's so important to hear stories about what people are trying to do, what they're working through, what their challenges are. So for anyone who is trying to do this, I know that it's hard, and I hope that the people that listen get some insight to, one, help it like not feel so lonely out there trying to do this thing, because it can feel that way. I think Jeff and I both talked about experiences where we felt a little bit on an island trying to make this thing happen in our respective clinics. Um, but that you get the insight that you need to make a different kind of medicine for our future. I know that that medicine is going to change. Like it is changing, and it's going to change pretty substantially here in the next decade. um I think we all have the power to like contribute to that change in positive ways. And I think really, if I was going to say like what the mission of what we're trying to do is to make that be a way that includes like really good preventive integration of exercise and other areas of lifestyle. um so I hope people get some insight into some of the challenges, get to hear some stories that relate to them, and that we cover some topics that, I don't know, maybe lead to an aha moment, or that provide insight that you haven't heard of before. But I know there's people out there trying to do this, and we if there's anything that I know, Jeff and I have tried doing it for long enough that hopefully you don't make some of the same mistakes that we have, and that you can learn from us and the guests that we have too. So
Exactly. So, as the listeners and viewers have heard from the intro, the outro, the commercial that I interject in between, one of the ways that you can follow Thomas and I and learn more about all of this stuff and get deeper into it is the website that we have co-created, which is mrfinstitute.org, Medicine Rehab Fitness Institute.org. And would also love to invite any clinicians and fitness professionals who are listening to this to become part of our NSCA Special Populations Special Interest Group on Facebook, which I'll make sure to put in the show notes as well. But Thomas, is there any other way that people can, either follow you, whether it's LinkedIn or any other platforms that you're on, that people can follow you, and besides our podcast and these other things I just mentioned?
yeah, for sure. Yeah, the best way to reach me online is via LinkedIn. You can also go to pinnacle-pt.com to view the Pinnacle website. I have a bio on there, and some contact information if you want to reach out to me via email. But LinkedIn is the easiest. It's Thomas Hammett. I'm the PT guy that's on there, so yeah, I'm pretty easy to find. But yeah, I can include a link in this for show notes, Jeff, too, if you're doing that kind of thing.
Yeah, perfect. All right, so we have a zillion things to build on over the course of time, but I'm so glad that everyone got an opportunity to really start to get some insight as to who you are, what you're about, why you're, in my opinion, very different, and why you're worth listening to. And yes, I do wish that it's not me, that it was that you and I were like co-teaching a course at every college and university and med school and every conference that exists, because I just feel like the combination of what we both provide could really benefit and open the eyes of a lot of people. So Thomas, thank you so much for your time today, and I really look forward to continuing this podcast with you.
Yeah, thanks for having me, Jeff. Appreciate you letting me sit in this chair today.
All right. I hope you enjoyed listening to this conversation and better understand why Thomas is someone the whole field of PT and medical fitness can learn from. Please go to mrfinstitute.org and our YouTube channel at the Medical Fitness Podcast for information on how to learn more about the education we offer and to stay current with the podcast series. Thanks for tuning in, and we'll see you in the next episode.